This is Andy Pekosz, Associate Professor of Molecular Microbiology and Immunology at Johns Hopkins University Bloomberg School of Public Health.
And this is Brian Simpson, editor of Johns Hopkins Public Health magazine. We're here today to talk with Dr. Pekosz about the 1918 flu epidemic and other flu epidemics, and in comparison with the H1N1 flu. Dr. Pekosz, thanks very much for talking with us today.
Thank you for asking me.
Great. Let's begin. Can you tell us a little bit about the 1918 flu epidemic and why was it so deadly?
There were really several reasons why the 1918 influenza pandemic was so deadly in the human population. First, and probably most importantly, is that there seemed to have been very little pre-existing immunity to that particular influenza virus strain in the human population, which basically meant that over 90% of the human population was susceptible to that particular influenza virus strain. Second, the virus that caused that pandemic had some very unique properties about it, things we call virulence factors, which caused it to generate a very robust infection and a very robust immune response, and therefore much more severe disease in humans than we see currently in seasonal influenza. Another reason was there were a large number of secondary bacterial infections associated with the 1918 influenza pandemic. So you would get influenza first. As you were recovering from that, you would get an infection with a bacteria, and oftentimes that would lead to pneumonia, and there's a very high case fatality rate from bacterial pneumonia at that time. But interestingly, eventually that 1918 virus became less virulent. It entered the human population in 1918, and it continued to circulate in the human population until 1957. But after about 1920 or so, it no longer caused that very, very severe disease that was associated with its first few years of infecting the human population. And we think there are probably two reasons for that. One is that there's immunity in the population then that started to dampen the disease. But we also know that the virus lost some of those virulence factors that it initially came into the human population with. So it's an example of how dynamic the interaction of influenza virus is with human hosts, and how viruses change over time to give you drastically different outcomes when they first enter the human population.
And if the 1918 flu struck again, would it be more or less deadly today?
It would probably be less deadly today for, again, a couple of reasons. One is we have antivirals that are effective against influenza. We also have antibiotics, which can work to treat those secondary bacterial infections that seem to be so prominent in 1918. And finally, we have better overall treatment of individuals with respiratory diseases. And so people who were getting ill could get better supportive care than they did in 1918.
And those secondary bacterial infections, are those primarily because the influenza virus had just sort of weakened the person's immune system so much?
There's a couple of reasons why you're prone to secondary bacterial infections. One is, yes, the fact that your immune system is weakened because so much of its attention is turned to the virus. But it's also clear that the virus, by killing your epithelial cells that line the respiratory tract, changes the environment of your lungs and makes it a little bit more easier for bacteria to come in and colonize and establish themselves. So the virus itself is sort of setting up your lungs for a secondary infection with bacteria, which you may come into contact soon after you're infected.
And the 1918 flu, tell us, was that a swine flu or was that an avian flu virus?
Everything we know right now, it looks like the 1918 virus was an avian influenza virus that made a jump almost directly into the human population. Interestingly, though, there are a lot of reports from 1918 that the 1918 influenza virus could infect pigs. And in fact, that 1918 influenza virus was isolated from pigs up until the late 1950s to early 1960s. So when 1918 influenza entered the human population, soon afterwards it also entered the swine population and stayed there as well.
Wow. Could that have moved from humans to pigs?
Yeah, we lack enough epidemiological information to say that for certain, but it's more than likely that after it entered the human population is when it entered the swine population.
Huh. Well, let's move on to the 1957 and 1968 epidemics. How do those compare to 1918?
Well, there are some similarities. For instance, in both of those examples, the viruses that entered the human population were new influenza viruses, so there was little pre-existing immunity to those particular influenza viruses in the human population. However, those viruses weren't as virulent as 1918. Again, they lacked some of these virulence factors that the 1918 influenza virus had. So the disease they caused wasn't as severe as 1918. But because more people were susceptible to infection, we had a dramatic increase in the number of cases of influenza, and therefore the number of cases of severe cases of influenza and the fatalities associated with influenza.
There's kind of been a sort of I don't know if it's a public health maxim that would say that we're kind of due for a big flu epidemic every 30 or 40 years. Is there anything to that?
Well, certainly the emergence of a pandemic flu in the human population really is a combination of several random events. So there's not a true sort of cyclic nature to this or seasonality to it. It just depends on when a particular virus with a particular set of genes has the opportunity to interact with humans and establish itself in the human population. This doesn't happen very frequently. Again, in the last century we only had 3 pandemics. But it certainly doesn't happen at any kind of regular interval.
Mm-hmm. And there's with H1N1, there's been a lot of discussion, whether this particular outbreak, H1N1 2009, is indeed a pandemic. Where do you come down on that?
Well, everything that is so far that we know so far about the new H1N1 infection really to me implies that it's very similar to the 1957 and 1968 pandemics. So this is a virus that there's little existing immunity to it in the human population. It doesn't cause a very severe disease, but if it really does establish itself in the population, it will probably cause a pandemic of the magnitude of what we saw in 57 and 68.
Mm-hmm. And in the past few years, public health authorities and global health officials have really been looking to Asia for a avian flu pandemic, sort of at the beginning of a pandemic there. Why did we miss the boat on swine flu coming out of Mexico? And has this really changed how we should be looking at things?
Well, both 1957 and 1968 pandemic influenza viruses appear to have originated in Southeast Asia. And certainly with the H5N1 outbreaks that have been occurring since 1997, primarily in Southeast Asia, but have since spread, that was really a focus of our efforts in terms of monitoring for influenza. The emergence of these pandemic influenza virus strains really, though, is not a question about geographic location as much as it is things like farming practices and environmental factors that bring together different animal species that carry different types of influenza that can sort of facilitate this transfer of viruses from one species to another. And so certainly any place in the world where humans, pigs, birds come into contact with each other, there's a higher likelihood that the influenza viruses that those species carry can infect another cross species and generate new influenza virus strains that have pandemic potential.
And we're talking in early summer right now. What are your sort of predictions for the fall for H1N1? Well,
the first thing that we're going to be looking for is which influenza virus strains emerge in the southern hemisphere. If this new 2009 H1N1 virus emerges in the southern hemisphere, then we can be relatively certain that it's established itself in its human population, and we should expect come the fall, early winter, that it will reappear in the northern hemisphere. Based on the number of cases that have occurred not only in the U.S. and Mexico, but in Asia as well as in Europe, it seems likely that this virus has established itself in the human population. So we'll see what happens in terms of it spreading to the southern hemisphere, and we'll also be very vigilant in terms of monitoring its biological properties to see if this virus is changing in any way as a result of its passage in its new host, humans.
Well, Dr. Pekosz, thank you very much for talking with us today.
My pleasure.